So here you are watching coblation tonsillectomy in a 9-year-old child with history of obstructive symptoms. We are also going to do is adenoidectomy and septoplasty, turnoplasty at the same time. Now you can see how large is the tonsil. It's inside, it's right here. I'm starting with, you can see the palate is supported by the or suspended by the rubber catheter. Now I'm starting on the right side with coblation by Smith and Nephew at the setting of 7 for ablation and 3 for coagulation. Alright, so this is my marking and I'm supposed to reach the plane in the first instance, because if I do not reach the plane correctly, can you do a lot of glare? So I have already reached the plane. I'll show you the plane in a moment. That's the plane. Alright, now I will further deepen my plane and try to remain exactly in the plane so that, see how much of tonsil tissue was inside the pillar. That's called endophytic tonsil, and these are the small blood vessels which I'm coagulating. All the small blood vessels are being coagulated so that there is no bleeding after I have. Can you focus it better? Is it focused? All right, right. Thank you. All right. See, this is the tonsil tissue, and you'll get the muscles on the other side. So I have to remain between the muscles and the lymphoid tissue. So these are the connective tissues which I am dividing. Can you see this? There is no exposure of the muscles so far. So if I remain in this plane and do not expose the muscles, then only the surgery will be painless and bloodless. Now see, this is the tonsil tissue again. So this is a cotyledon of the lymphoid tissue which is buried inside. So I have to dissect that out. Alright. Now I will further carry my dissection. See how large is the upper pole of the tonsil, and that is the cause of obstructive sleep apnea, which is getting removed. Now you can see there is no muscle exposure as of now. It is all connective tissue. So there will be no pain. It's like intracapsular surgery. So till this part, it will be a completely painless and bloodless procedure. Now as we proceed, we might have to open up certain planes where the muscle will be exposed. In extracapsular surgery, at times you cannot avoid exposure of the muscles. That becomes a little painful. Till now, we have been successful in not opening up the muscle plane. But obviously, it's not possible in the entire extent because as you can see here, some amount of muscle is exposed. Can you see this? So there's a difference between this and this. So we have to minimize the exposure of the muscles. Now, this is the lingual tonsil starting. This is the lingual tonsil outside the palatine tonsil. Now we are still dissecting very cleanly between the lymphoid tissues and the muscles and only concentrating on dividing the connective tissue fibers. Now, here now we are entering the lower pole. So this whole thing is the lower pole. The lower pole is not here. So we can get the tonsillar artery anywhere in between. So now we will keep our dissection very, very close to the lymphoid tissue and will not enter into the tonsillar artery. So the tonsillar artery could be anywhere here. So I am coagulating on the course of the tonsillar artery and then dissecting on the medial part so that I do not divide the tonsillar artery in its main course. And the tonsillar artery is already coagulated along the length. So it is unlikely to open up in the post-operative period. And here I might go a little intracapsular. Can you see this? Now I'm going a little intracapsular, not leaving behind too much of lymphoid tissue. I'm going a little intracapsular so that I do not damage the tonsillar artery. That's called hybrid tonsillectomy, my concept, which I'm doing for the last 10 years. This prevents, this is the little bit of lymphoid tissue, again coagulate along the course of the tonsillar artery and then dissect along the medial aspect. And you see there is hardly half a millimeter of tissue which again I am coagulating. So there is practically nothing left, but the chances of bleeding are minimized because you are not directly dividing the tonsillar artery. So severe bleeding by the tonsillar artery becomes very, very unlikely. Now you see this is the end of the tonsil. We again intracapsular here, not leaving behind any. Can you see? All right. Now let's see the fascia. So as I said, it's impossible to completely, uh, you know, avoid the exposure of the muscles, but majority of the, can I have the smaller one? But the majority of the tonsil fossa is covered with the fascia. So whatever part is covered with the fascia like this will be totally painless. Wherever the tonsil was closely attached and you have exposed the muscle fiber, there will be a little bit of inflammation, little bit of pain here, but that will be minimal. So this is extracapsular tonsillectomy in a 9-year-old child. And you can see this is a hybrid tonsillectomy. The lower part is intracapsular. You can see a little bit of lymphoid tissue, just half a millimeter as a cushion for bleeding at the lower end. Thank you for watching.